The medical understanding has changed very little in the last 200 years. It was called the sugar disease, and in ancient times it was named because of the excess urination, and the urine contained a lot of glucose, and people craved sugar, and then they discovered the blood was loaded with glucose, and so it began the medical concept that it was the glucose or the sugar disease, and the standard cure was to make them unable to eat sugar, imprison them if necessary, and they would just die anyway, but they kept them from satisfying their sugar hunger. And then insulin was discovered, which would, for the people who were wasting away with what later was called type 1 diabetes, insulin would allow them to build muscle and put on fat instead of breaking tissues down and excreting it in the urine. But the sugar disease concept stayed with the medical profession, even though insulin deficiency came to be the idea of its cause. But then, as they looked for more ways to sell insulin, they noticed that lots of people who weren't wasting away and dying at a young age also had very high blood sugar. Some of them had sugar in their urine. Yet when they tested their blood, they found it had a normal amount of insulin in it. But anyway, they were good candidates for treatment, so it came to be called type 2 diabetes, even though the original concept was that diabetes was a wasting disease in which you quickly died of tissue wasting. But now fat people became something like 95% of the patients for treatment of their high blood glucose. So it definitely isn't a problem of insulin deficiency for the great majority of people who are diagnosed with diabetes.